Hey, Mark.
Goodness.
Still look tired.
Oh, yeah. I think the yawn is the bookmark of the day.
You're right. I think I don't know anything about it.
So, bravo. You all did a pretty good job today. Good work.
Thank you.
Now, before we finish up for the day, are there any questions or anything you'd like to review related to vital signs?
I had a question.
Okay, what's that, Melissa?
Well, when I was taking my patient's blood pressure, I had a really tough time hearing anything. I don't know.
Okay, see, that happens sometimes. Now, if you find this is a problem, you could try, try making sure the room is quiet. And check your equipment and connections. Check your stethoscope for the correct positioning of the head if it's a dual head, so the sound is being conducted through the bell or diaphragm. Well, depending on the site you're using, of course. Let's see. Yeah, recheck the location of the brachial artery and make sure you have the head of the stethoscope directly over the pulse site. Now apply a little firmer pressure to the stethoscope just to be sure that there's a good seal between the stethoscope and the skin. And let's see, now if you're still having trouble, you might want to try another limb, if that's possible. You should practice blood pressure measurement often in a quiet room to become more comfortable with it.
I'll keep practicing.
Good. Now, sometimes there are other situations you'll have to make special accommodations for. You see, earlier Mark worked with a patient who had a right modified radical mastectomy and had a PICC line in her antecubital fossa. Mark, tell me something. How can you go about measuring her blood pressure?
Well, you can't take her BP on her right arm because of the mastectomy.
That's right, because, see, there's an increased risk of lymphedema.
And you shouldn't use her left arm because the PICC line is inserted there. Pressure from the cuff could damage the catheter or injure the surrounding tissue.
And so what would be the best site?
I guess the best blood pressure site would be her thigh.
Good. And Melissa, what's the procedure for taking a blood pressure on the thigh?
Place the stethoscope behind the patient's knee using the popliteal pulse.
Right, and just keep in mind that systolic readings in lower extremities are about 10 to 40 millimeters higher than the brachial sites, but diastolic pressure is about the same at either. How about the situation? While you're trying to measure the respiratory rate for a patient and you're not able to see their chest rise and fall, what would you do to correct this? Come on, anybody?
Melissa? Katie?
Thanks. Mark.
Okay, that's okay. It's sort of a tricky question. Now, the way to handle the situation is put the stethoscope on the apical site and watch the chest rise and fall at the sternal notch, or you can just focus on the rise and fall of your hand on the stethoscope. Okay, any more questions?
No, I don't think so.
Well,
Not
then
for
I
me.
guess that's it for the day. And again, you all did a really good job, and you're off to a great start.
Thank you.
Thank you
Okay,
very
you
much.
should take
Miss
this
Conn.
evening to review the skills that you were able to perform today, and have a good night.
All right.
Great.
We'll
Thank
see you all
you.
tomorrow.
Thank you.
Thanks a lot. Oh. After you.